Good evening, everyone. Welcome to our mastermind call. And we are excited to talk about lots of topics. I mean, is there anything going on in the world right now, or is it just me?
Just you. Nothing going on in the world.
Is it like insane or what? I mean, there's just so much happening out there right now. So um, we'll get rolling here. I mean, we've got these topics that we sent out in the email, but we can talk about other things. So I guess I'll start off with if you guys who are on already, I know there's still some more joining. If you have some questions for us tonight, let me know what's on your mind. I mean, with everything that's going on, I just want to make sure we're talking about what you want to talk about. So, anybody got a question right off the bat?
Uh, I do.
Paula.
Yes. Hi, Dr. Towers.
Hello.
Did you have a question?
I heard. I do. I was just wondering how. I just wondered how other people are how what kind of resistance that people are running into from their staff about being vaccinated. My staff is Patty and I are the only ones that are vaccinated, and in fact, I had mine so long ago. With the first responders and so forth, I guess in February, that I'm really hoping that they come out with a booster soon, because I mean mine was pretty long ago. But my staff is just very, very anti-vaccination.
Yeah, I can
And
understand that. I can understand that. Mm-hmm.
and so I was just wondering, like, what other people are having. I mean, I'm having a little bit of difficulty because one of my assistants' dad has COVID. She doesn't really actually live in the same house with them. She's really young. She's like 20 years old. She lives in an apartment over the garage.
Mm-hmm.
She's symptom free. She had a COVID test. She's negative.
Yeah.
Her doctor said that she could come back. This was like last Friday. She could come back, today, Tuesday. But nobody here wants her here. And it's just the thing is, I mean, they don't wear their masks out in public all the time. They don't know who they're around. And I don't know. It's just really frustrating. I mean, I feel like, we need Lindsay, and, she's just not here for no real reason that I can understand. I mean, it's like you know they're afraid they're going to get it from her, but yet they're around
Yeah.
other people. They don't know their status all the time.
Yeah.
So anyway, I don't know. It's just
Yeah.
a really tough situation for me.
It is a tough situation for everybody right now. Everybody's going through this. So I don't know if I know there's a few on, some may not be on mute. Who else would like to address this? What are you doing with your team? And I mean, some of this is state by state. Who wants to
I
answer?
can say Maine has just mandated healthcare workers to be vaccinated. And
Yeah, I just saw an update about that, Dave. Did you see that update?
today, I did not see anything.
Today, just tonight. Let me read you what it said. It said, I have heard that the Board of Dentistry had a non-published, non-announced, no way to observe emergency meeting tonight where they punted the governor's mandate to DHHS to decide. I hope that a meeting in secret did not happen. Does anybody know? Yeah. So that's what I just saw a few minutes ago, right before I came on.
I don't know anything about that, but that really is almost immaterial because the Board of Dental Examiners would consider any breaking of the law to be unprofessional conduct. And the law says that we're mandated to have vaccines. So that's I don't know that the board has any power in this instance.
Yeah, I don't really know.
But I had a meeting with one of my team. I'm hearing your concern. It's interesting that people are afraid of someone who might be infectious, but they don't get the vaccine, which is their number one protection against it. That boggles my mind, because I have 2 team members who in my case, it's only 2 out of 29. So I'm in a lot different situation, but they're really key team members. One has been with me 15 years. And to lose her would be really, really sad. But I have no choice.
Yeah. Well, to be
Really-
honest with you, I wish I had no choice. I wish Alabama would do the same
Yes.
thing, and then it would be like, well, it's not me, it's them, and you got to do it.
I feel I feel that from you. I understand what you're saying with that, because we've been talking about it, because patients are now calling and they want our team to be vaccinated to feel safe to come in. It's
Yeah.
and what I can't understand is, I spent a ton of time researching all this and asking people to send me, what are you finding that's telling you not to get vaccinated? And I can't get anything from anybody that says not to get vaccinated. It's just I don't want to. I don't think it's safe. But there's no data. When I look at the data is like hugely. I mean, you're hundreds of times more likely to die of COVID than have any problem with the vaccine. It just doesn't make any sense.
I just can't understand. Like I grew up, in Delaware, and we had, Amish in our community, and they were, anti any kind of vaccine. Like they just wouldn't go for it. Now, but these same employees, they're vaccinated against measles, mumps, rubella, chicken pox, all this stuff. I just can't understand why they have a problem with this particular vaccine. Does anyone know?
Yeah, I know. I mean, it's really hard. I've tried to kind of be unbiased in this in data and share data. I think a lot of young ladies' hesitancy is the information going around about miscarriages and sterilization. For example, my close friend who's a nurse at a university hospital, she's in childbearing age, and she has said, no way. So that may be, I don't know what their concern is. There's also the vaccine allergic reaction reporting site. I think there's 7 of them, maybe. VAERS, VAERS, maybe openvaers.com if you want to go check there.
Yeah, I have looked at that, and I've looked at the allergenicity, and there's only two chemicals in any of the vaccines that are even remotely allergenic. And
Yeah.
the allergenicity of this vaccine is extremely remote.
Yeah.
Paula, have you been vaccinated?
I'm going to plead HIPAA on that.
Well, I was just wondering, there are reasons that people have not.
Mm-hmm. Yeah.
And, there are religious reasons and different
There are.
things. But there are people that are 40 years old now that are dying from this.
Yeah.
And with no underlying health issues.
Yeah.
With no underlying health issues. And so, I mean, with our team is one thing. If you have a number of people there in your team that have not been vaccinated, why is that? What are the patients saying? But also, why are they resisting the vaccination? Which I'm sure they're good reasons. But at the same time, I've had COVID. I've been vaccinated, and I feel, when I had COVID, it was real easy. So I don't feel like I'm having any problem, but damn, I'm going to get a booster when I can for the protection. And it's not because President Biden is telling me. I sure ain't gonna do what he's telling me these days. I never did in
Yeah.
but I think it's a thing for me personally, for my health, but also for my family. And I think that is what is occurring is the people that are unvaccinated are getting in the hospital, and it's affecting them, but it's affecting the people around them. And I think that's what we have to look at. It's not just ourselves, but the other people that are affected by us and our health.
Good point.
Well, let me see this. So
I'm showing
sorry.
on the screen. I know you can't see this if you're on the phone, but I'm showing the CEDAR solutions recommendation on verbal skills to patients. It's really a HIPAA conversation when patients ask you if your team's been vaccinated. Somehow we've lost HIPAA in the process of this. So anyway, this article is here if anybody wants it. So go ahead. You had another statement question?
I had a question. I don't know. Patty, are patients asking if the team has been vaccinated?
We have had not a lot.
We've
but
had
some.
we've had a couple that have asked, but like I say, besides Patty and I, there are 6 other people. Is that right? Yeah, 6 other people besides us, and none of them have been vaccinated. One of them is, a couple of them have already had COVID. They're really young, and they got over it easily. Only way, they knew they had it was loss of smell, for a while, but no other sickness or whatever. We're not getting like a ton of questions, I don't think. I mean, I have not been asked once if I've been vaccinated myself. Well, I would tell them if they asked me, but they haven't asked me. But what I'm saying is, so Patty and I are vaccinated. The other 6 are not. They range in that, basically from I don't want to I really, 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 really don't want to. And I'm just wondering, like, what, and unfortunately it's not mandated here, so it's still on me. I'm just wondering what people think about that situation, like what the collective thought process would be, if anything, that I should try and do about this situation. Because right now, if that one team member were vaccinated, I mean, she could be here right now. But the thing is, they don't care about any of that kind of stuff. Like, even if you are vaccinated, if you've been around it, they don't want you to be here, and all this kind of stuff. It's just a very weird situation where they don't really want to follow the CDC guidelines, or even trust the whole thing that, if you've been vaccinated, that you don't have to quarantine or whatever. So anyway, it's just a very weird situation that I'm having a hard time kind of figuring
Yes,
out.
and what I have on the screen right now is adding fuel to the fire. That as of December 31st, the CDC is saying no more PCR tests, that they're not accurate and don't distinguish between the flu. So this is adding fuel to the confusion. There's also the cycles they spin the test for. I mean, it's just really, really a nightmare. It's a nightmare. So some of you can see this. I mean, what's the conversation about this, guys, in your community, about the PCR test and the flu?
I would say neither one of them are really topics.
Not being talked about. So yesterday I had a doctor text me, and she said this was a positive thing, if you ask me. Just from my perspective, I think it's a positive thing that the team member was showing some symptoms and went to the doctor and was tested for RSV, strep, flu, and COVID. So I think that's positive. I don't know. What do you guys think about that? I mean, previously we haven't been testing for anything but COVID. What?
Yeah.
So I think a lot of people are just getting generally sick. Maybe still a lot of his friends are sick, but not necessarily with COVID. I think people just get sick.
Yeah, distinguish between, strep, RSV. Now, my daughter's a pediatrician, and she said RSV is rampant right now. She said she's never seen RSV in the summer, and adults are getting it as well as kids. So, um, I don't know. I mean, what do y'all think? If it's not distinguishing between the flu, which it says right here, um, it does not detect between the influenza viruses, which is a big criticism of the PCR test, plus the number of cycles that they run. Shouldn't they be testing for these other things? I thought that was a positive sign that they're going to be testing for more than just the COVID and the RSV, the strep, the flu, whatever. Any opinions, thoughts? I know, Dave, your wife's a nurse. What is she saying?
She says that everybody that she talks to, that all the people in the hospital are non-vaccinated.
Mm-hmm.
That's number one. Number two is that it is COVID people fear, and false evidence appearing real, no matter how you call it. It is what the society is fearing.
Yeah,
and
of course.
therefore, flu is rarely fatal for healthy people, almost never.
Yeah.
We go to work with colds all the time.
Yeah.
These are things that are just part of life.
Yeah.
COVID's different.
Yeah.
So that's why COVID becomes the target. Just like the other one I would say in that same ballpark is Lyme disease. Lyme disease is affecting people's lives.
Yeah.
COVID is affecting people's lives. If there were a vaccine against Lyme disease, I'd take it in a second.
Yeah.
I have a tremendous fear of Lyme disease, being from the Northeast where it's prevalent. But
it's very prevalent here too in the South.
But also in all my research, it just says that the vaccine is one of the safest vaccines ever been created, and that it does the risk benefit ratio is just, there's just not, my mind's mathematical and scientific.
I think part of the conversation is about being forced to do something instead of having the choice. I think some resistance is about that. Is that what you guys are hearing?
It's kind of like, Mommy, if you tell me to do it, I ain't gonna do it.
Why do you think they don't want to do it, Patty?
I just think there's a lot of false information on social media that people are reading. I believe it. And it's causing all these false beliefs, and it's creating people. That's part of the problem, I think.
Yeah, that's what I'm hearing is like, I read this or that on Facebook, but of course I don't get on Facebook, so I don't know. But I mean, that's what I'm hearing is what they read on Facebook.
Yeah, that's interesting. I don't get on Facebook hardly I don't post hardly anything anymore, just because of all the censorship, and you don't know what's true and what's not true, and they pretty much block a lot of COVID information. So I don't know what, hey Barb. So it's not an easy situation at all. I think, like you said, I think the main thing is, I mean, I'm not anti-vax at all. I think a lot of people do not want to be forced to have to do something. I mean, this may not be a good example, but you've probably heard the "My Body, My Choice" slogan, and what that goes. What's that?
The other cartoon. Did you see the other cartoon on that?
No.
Your body, my choice. Meaning, my choice is not to vaccinate, so I'm going to infect you.
Oh, I gotcha. Yeah. So that is a big part of the conversation. I just don't know, guys. I don't know what to tell you. Dr. Paz, do you have anything you want to share on this? Or you want to stay out of it?
Not at this time.
Stay out of it. I hear you. Anybody else want to share? We can move on to another topic. Good question. Good question. Thank you for asking. And it is on top of everybody's mind right now.
Well, I think the biggest issue is not with us personally, but what do you do with your team when you feel like they should be vaccinated and there's resistance? Now, I do not have to be concerned about that now.
Yeah.
Because I'm not in the office. But I think if I were in the office and leading the office, that would be one of the things. Okay, I'm vaccinated. I feel like you should be. What is your resistance to it? And how do we handle that? So not an easy thing.
Well, it isn't an easy thing, Andy. And one thing I read from the HR company was if you choose to mandate that for your team, just be prepared for liability if something happened.
Yeah.
Vaccination.
Yes, if something happened and.
Your team mandated and fair.
Yeah, Patty, I hear you. I hear you. So you have to be prepared for that liability if you mandated it for your employees, apart from a national mandate or some other mandate. And now when, like Dave in Maine, and they mandate it, I don't know exactly what your liability would be. Maybe none if it's coming down from the government. I really don't know. Do you know, Dave?
Yeah, I think that I have no choice because I would lose my license if I keep them on. So,
Yeah.
because I could break the law. But
so that may be a different situation, but if you're in a state that it's not mandated and you're mandating it, I believe that's a different liability.
It could be. Now, of course, Facebook's done it, Google's done it, Microsoft has done it. So that's actually interestingly one of the articles I read just last night from University of Alabama talked about how that's one of the signs that the vaccine is safe is that the lawyers aren't, the vultures aren't circling around the vaccine. It's kind of funny.
Yeah.
But the challenge is, it's really sad because I have a 15-year employee and a new employee who's just a superstar, and to lose those two employees is just killing me.
It's really
and
sad.
I love them both, and I really care about them both. I want them to be vaccinated for their own safety, but it also just makes me feel really sad.
It is extremely sad. This is like the most horrible decision that you have to make as a team member and as a doctor. I mean, I just wouldn't want to be in that spot. It's just really not a good place to be. And I'm sorry. I'm really sorry. I wish this would all just be over. I'm so tired of it, aren't you?
Good luck.
Yeah. I'm just ready to move on with life,
Just like Afghanistan.
Oh, yeah. Oh my. What a mess. What a mess we're in. What a smell of a hess we're in.
Yeah.
Wow, the Taliban goes into it.
Yeah.
But then you look at Haiti with the earthquakes and the tropical storms.
Yeah.
We're a heck of a lot better off.
Oh, we are. I mean, really. We are blessed. We're blessed. Okay, so anybody else have a question, or we can go to some of our topics?
I'd like for you
Okay.
to see this.
All right, so let's go to your just quick reminder on fall hygiene schedule. That COVID bubble seems to follow us. For some of you, you've already conquered it. For some of you, you really have to watch again this fall for that. The March 2020 translated to October 2020 translated to March 2021 in April, and now it's translating to October in 2021. So make sure you look ahead at your hygiene schedules and make sure you don't have that bubble showing up again. Y'all know what I'm talking about?
Yeah.
Yes.
For some of you, it's not a problem. And like I said, some have overcome with new patients or they've really worked their database and they're filling that time. I want to show you a funny picture. Who's been hiring? Anybody been hiring?
Yeah.
If you're not hiring, you're blessed. So I came across this picture today and I thought it was just so funny. Now hiring people that show up.
Yeah.
Who's I know somebody on this call who hired somebody that didn't show up. Supposedly this is in the Denver area, but who knows really where that came from. But you know, we have this ghosting phenomenon. You know what I'm talking about?
Yeah, we had that happen to us. We offered a job to somebody and she didn't show up.
Yeah, I mean, it's really crazy right now. I'm seeing several doctors being kind of held over the barrel of, you know, I this office down the street. I wasn't looking, and this office down the street offered me $5 more an hour than what you're paying me. I'm seeing that. I'm hearing that from several teams. So we're seeing the hiring market just really go crazy right now, as we've talked about before. Then you've got your Walmarts and your Dunkin' Donuts starting them out at $17 and $20 an hour, and so it's not fun. Anybody else have anything they want to share on the hiring market right now? All the more reason to do your compensation worksheet with your teams. Does everybody know what I'm talking about when I say compensation
Yes.
worksheet? Yeah, are you doing that?
No, not yet.
Okay. Let me pull one up just to kind of show you what I'm talking about. So this is something you want to do with your team at least once a year. And if you hire someone new, it looks like this. So it's the total package of what you're offering them, not just the hourly rate. You just can't go by the hourly rate. You've got to show them the total package. And they have no idea what their total package is. And so when they go comparing, well, somebody's going to pay me $1 more or $5 more or whatever, are they really comparing apples to apples? Right? Okay. So don't get held over the barrel by it. And, you know, a lot of doctors are feeling like, oh my gosh, I have to give it to them because I don't want to lose them. It's really a challenging situation. Anybody else have anything you want to share about that?
Paula, I don't know that this is a new phenomenon.
Yeah.
You know,
No, it's not.
I was in practice for 45 years, and it's there's always someone that wants to quote pay more, and or an employee that comes in and you hire, and I wanted to go to nursing school, or I always wanted to be an orthodontic assistant, so I'm going to the orthodontist. So the main thing is if you don't mind my sharing, the main thing is taking care of them and know that they're appreciated.
Yes.
What is the number one thing that employees look for?
Appreciation.
Yeah.
Appreciation. The money is down the list.
Preach it.
So if we're not taking care of the employees and not appreciating them and not telling them thank you, they're going to go somewhere that will, whether it's $1 or $2 difference.
You are so right about that. It really is the team loyalty survey, which we've talked about several times in different programs. Is, you know, the number one thing they want is appreciation and respect. Then they want to have fun during the day, not just events after work, but they want to have fun during the day, and they want to be challenged, and they want to be paid. So when money comes to number one, that means appreciation, respect, fun, and challenge are maybe missing.
Yeah, big time.
Yeah. And so this has been around a long time, what I'm seeing that's different right now is that instead of them saying the office down the street offered me $1 or two more, they're offering $5 more. And it's really messing with overhead. Messing with overhead big time. So that's why we're talking about raising fees. You gotta consider raising fees, looking at your fees, even if you raise them in January. I mean, inflation. Oh my gosh. Eric had a great graph the other day. Let me see if I can find it. Yeah, it was inflation calculator. So let me show you this. Here's where we are, and you may want to take a screenshot of this and just share it with your team. This is United States annual inflation rates 2011 to 2021. And he got this from inflationcalculator.com or something like that. Look at where we are. This is where we are right now, 5.4%. Most of the time when we raise our fees, we raise them 1 to 3%, right? That's not going to cut it in this market. And the other point is if you're on a lot of PPO plans, you can raise your fees all day and it's not going to matter, right? um, anybody have any thoughts about what you're doing with your fees right now or inflation?
And we raised our fees and we're reviewing them again.
Good idea. So anybody else doing that?
Yeah,
Yeah,
we've
we're
done.
doing that.
Good, Dr. Bulsara. Dave?
Yeah, we were originally going to raise them 3%. We changed it to 5%.
Okay, good deal. All right. I know some of you can't be talking, but it is really important thing to do right now with the current market. So I'm glad we're looking at that. Let me show you something else that just came across my desk today, and that's about changes in insurance plans for 2022. So this was pretty interesting. And Dave, on the Zoom camp we had with the admin teams last week, we shared a lot about, we didn't have this information at the time, but we did share about the first part with the fees reduction from some of the insurance companies. And we did talk a lot about membership plans and Advantage. And I mean, if there's ever a time to do it, it is now. Wouldn't you say, Dave?
Absolutely. It's always the time to do it.
It is, absolutely. And I think on the Zoom camp, I know we were going to talk about some of the highlights from that. One of the highlights that came out of that is that maybe a lot of people have a membership plan. They're not really signing people up on it, and they're still doing the annual fee instead of a monthly fee. And you're not going to get quite the participation, especially from new patients, from the annual fee. Is that right, Dave?
Yes, the real advantage of the monthly fee is just the automatic rollover. Plus, if you raise your fees, it's no big deal to raise it $1.50.
Yeah.
But if you raise it $18, they notice it more.
That's exactly right. Yeah, for sure. And they're paying that big fee every other time they come in. So having the monthly fee is much more palatable, especially for a new patient coming in, where you can have. Don't you charge a registration fee, Dave?
There is. It's $55 for an individual and $95 for a family. And
Okay.
Interestingly, I fought it at the beginning. I didn't put it in my plan when we were working this all out with Ted and Dan, and they did, and they convinced me that it was better that way. And I put it in, and it didn't stop anybody from signing up.
Gotcha.
It was really good.
It really doesn't. I mean, it's much better to have the registration fee of $100 or $150 or something like that than charging them $300 or $400, which would be a full fee for a new patient visit.
Right.
Yes, and if they're an existing patient, you could kind of waive that registration fee. I mean, if they're checking out today, from their hygiene visit, and they're going to sign up now, and you're going to start their monthly payment for the next 6 months till they come back in, that's going to be fully paid for by the time they come back in. So there's no loss if they were to cancel their card or whatever, right?
That, yes, almost always when they sign up, it's because they're here and they're going to get a benefit, and that's why they don't mind paying that extra fee.
There you go. Okay, for sure.
So it just works, and it also means that they're making a commitment.
Yeah. Yeah, they are, and that works. And I'm a member at the dentist where I go, so I do it myself. I'm not just talking about this. I am actually doing it myself. So let's look at what I've got on the screen here. If anybody's in network with Cigna, you may have received a letter that they're cutting their fees 30%, and they're offering you, I think, maybe a check for $2,700 if you will accept their new fee schedule. That's sweet. I don't think that's going to cover the fee loss. I see that head shaking.
Robert.
Okay, as long as you don't treat the patients.
Exactly.
$2,700 for not treating them.
Yeah, if you don't take any more, stay on contract, but just don't accept any more Cigna patients.
Yeah.
Oh my gosh, yeah. So here's a couple other things that are coming down the pike for filing insurance. Temporary partial dentures, temporary complete dentures, or fixed bridges are all considered part of the overall treatment. This means you'll get paid for a temporary or permanent prosthetic, but not both. So how many of you file insurance claim for your temporary denture?
And also at a 30% reduction of what they used to pay.
Oh yeah, well, if you're on Cigna, yeah. And I mean, there's some other plans that are probably lowering their fees too. But this is for overall insurance filing from the way I understand this. Okay. See, as I peruse various contract offerings for next year, I'm seeing more clauses that will surprise most people. I know your first thought was her Friday nights must be wild. She's being funny. I don't think I'd argue with that, but here's some examples you may or may not have seen. So when you guys do temporary denture, do you charge for that, or do you wrap it all in the case fee?
We usually charge for it, but we don't submit a claim for it.
Okay. All
We
right.
do the same.
Okay. Okay. All right. Fixed bridges. So any temporary, anything. Most people don't charge for a temporary. Or is anybody charging for a temporary bridge?
No.
No. Okay.
Yes, if the patient's going to be going through implants and we're putting a bridge on that's going to stay on there for a year,
Okay.
then we charge for it,
Okay. That makes sense.
and we don't submit it.
Okay. All right. Very good. All right. Now here's another one. Payment for periapical. Dave, can you see the screen?
I'm on a phone. It's hard to see.
Yeah, that's okay. That's all right. I was just wondering. Payment for periapical radiograph images other than as part of a complete series is limited to 4 within a 12-month period, except when done in conjunction with emergency services and submitted by report. I'm definitely seeing an end to periapical radiographs being reimbursed without frequency limitations. So this has been something that we do to add some production for hygiene, add some value to hygiene. Has anybody been doing the 4 bite wings and 2 or 3 PAs?
We do.
We alternate the PAs with the bite wings.
Okay. So you're going to see, I mean, some people do that, once or twice a year. I don't know. So it looks like we may, and this is not every single plan, but they are going to start limiting how many PAs that we can take. And for people who use the PAs in hygiene and do like 7 x-rays, then that may throw a kink in their plans. I'm not sure. Anybody seeing this already with insurance companies?
Patty, are you
Yeah.
seeing a reduction in fee on our reduction in the number of x-rays that we can take?
Just limit. They're limiting. Okay. So we can go on to the next one. I've seen more plans covering the carries risk assessment codes. This is great news because many, if not most providers are not charging for this. So who's charging for carries risk assessment? Maybe like Diagnodent?
If not,
Okay. So you might give it a shot, file it. Anybody getting reimbursement for carries risk assessment codes? Okay. So this may be something that you want to check into, give it a trial run, see what's happening. So that's something new. Posterior composites are being covered at a lower rate than anterior ones. For example, number 11 will be covered at 80%, but number 14 will be paid at 65%. No posterior composite downgrade applies. You'll need to pay attention to how your computer estimates these costs. Actually, like this, the patient can see that the bigger fillings are covered at a smaller percentage. Yeah, that's backwards, isn't it?
Yeah.
Way backwards. So that may be something to keep an eye on. Also, one thing that helped me as a team member is warning the patient about this before they got their EOB. Does that make sense? So this follows that principle of under promise, over deliver. So you can tell them, you know, in some of the manuals that you have from me that have been in the programs, there's a page, maybe in the 80s or somewhere, it's insurance changes, we're issuing an insurance watch. So these are some things to add to the list. When you're sharing with your patients, you know, insurance contracts are changing. The premiums are going up and the benefits are being downgraded. So your premiums being upgraded, your benefits are being downgraded. How do you feel about that? Good conversation for your team to have with them. Your hygienist can start having these conversations while they're in the middle of the prophy and the patient can't talk. Say, we're seeing some big changes with insurance in 2022, and here's a couple of them. So,
It used to be that we are not going to pay the fee that you will get paid for a posterior composite is the same fee for an amalgam.
Yes, the least expensive alternative treatment. That's the LEAT clause.
That's a little change in paradigm now. They're not mentioning an amalgam. But anyway.
Yeah, LEAT, the LEAT, the least expensive alternative treatment.
Yeah.
That's what they used to always get on their bottom of their EOB. If we did a composite filling, they would get that down there. And the patients would always call and say, the insurance company denied my claim. I'm like, no, they didn't deny it. What they did was they changed the code. We're not allowed to do that.
Yeah.
We are required by law to file what we did. But the insurance company looked at it and went, oh, wait, we don't want to pay that. So we're going to lower that fee to a cheaper code, and we're going to pay that as if it were an amalgam, which we did not do. You see my point? How come we can't change codes, but they can? Who do you want to be your dentist? Us or the insurance company? You know? I mean, y'all get where I'm coming from? These are verbal skills for your admin team.
I have a question that's not so much along these lines, and I might just throw it out there. You can talk about it later. But I've had I had an oral surgeon call our office to ask why our referrals have gone down so much. And my office manager was just replying that oh, we had a transition in our office, and Dr. Pulsara has been doing a lot of the surgeries, and he kind of like, he asked if he wanted to speak to me, but then he said no, he just wanted to hear, talk to them, feel it out first, and then I think he's coming to our office next week. And I just wanted to throw out there, like, how should I have this conversation? Because now that I think about it, I haven't referred anything out of my office. I've been doing all the molar endo, second molar endo, extractions, wisdom teeth. I mean, I've been doing everything. And I think the referrals I think the specialists are probably wondering where these patients have gone.
What's up?
And so I don't know if there's any, if there's any advice on how I should talk to them and kind of like tell them, because I'm sure that they feel, I don't know, should I be throwing them a bone every now and then? Because I try to give my patients the option, but when they say they want to do it here, I offer the service. So it ends up getting done.
All right. Who's got an answer for that? That's a really good one. Thank you.
I've had that in the past.
Yeah. You kind of had that with your transition too, didn't you, Dr. Allgood?
Yeah, except I went the other way.
Oh.
I was doing a lot of endo extractions, that sort of thing, not any implants and all, but I decided I was going to the more productive procedures that I felt more comfortable with. But with this, number one, if you feel comfortable doing what you're doing and you feel very competent, and that your level of treatment is as good as those that you would refer to, then there's no reason not to do it yourself.
Yeah.
And that's the key. Don't do it for a financial reason, but do it for the reason that you feel like that you're taking the best care of your patients. And you can tell the surgeon that, or the root canal guy, I said, you know what, I've had extensive training in this, and I appreciate your help. And I would love, when I come upon something that I don't feel like I can handle properly, I would love to be with you and talk with you about it. Just let them know, hey, you know what? Yeah, I can do this. And I know that Dr. Watson is a fantastic dentist. At times he was more interested in getting on his motorcycle than in doing the root canals. But I love doing these, and I feel like I'm giving great care for the patients. It's not, well, I need it because I'm needing to pay Dr. Watson for all of this expensive practice I bought.
I think that's exactly how I feel, and that's probably exactly how I should just convey it when they come.
Yeah, I think that's absolutely, advice is right on the money, and just tell them that you do what you feel like you can do well, and that there are going to be limits to what you can do, and when you find those limits, you would love to have them work with you.
Yeah, I like that.
That's a
don't
good way to put it.
It's very difficult to contradict confidence.
Yeah.
But at the same time, they're coming to you because they may be concerned about their pocketbook. All right.
Yeah.
I'm not getting these referrals now. There goes my houseboat, and I can't go to the Cherokee Casino next weekend. Oh, darn.
There you go.
Well, I think part of growing part of growing the practice here was being able to provide treatments that were being referred that I do feel comfortable doing, and the patients have expressed like gratitude and not having to go and travel to get these treatments done. And I think that as our practice grows, being in a more rural area, it probably has affected these other practices pretty significantly, because I mean, we see most of the people in, North Georgia, Western North Carolina, in our area. And so if they're, they may have lost a good number of those, patients that typically would have come from our practice.
Absolutely. One thing that might be a good way to kind of shift the attention off of you if he comes over is to say, what would you like to share with me? What new things, what new techniques you're using in your practice? I'd love to hear about what you're doing. and
Mm-hmm.
the uniqueness that you bring to the area. And because one of the things I talk to a specialist about when I'm coaching them is going to the generalist and sharing with them your expertise and maybe some difficult cases that you've done and how they handle that, so that if you ever come across a difficult case like that, you would know, hey, I've seen a case that this doctor did and he's really good at that. So
Yeah.
I would want, if I were coaching the oral surgeon, I would have him come to you with, let me share with you some cases that I've done, and if you ever come across some of these situations, here's how I handle it.
Yeah,
I
I think that that's probably a good way to put it, because there's definitely cases that come to my office and
Yeah.
they probably need my help in, I'm going to say, selling the dentistry, but it's really, they probably need my help in having this patient explore the option of that more complex. Because when I see it, if I can't offer it, then at least I can, still bring it up and potentially send it their way to do stuff that I haven't yet gotten the
Yeah,
training to
for
do.
sure. And
Yeah.
it may be at some point, like Dr. Watson did, you may get to the place where, you know what, I'm doing all these full mouth cases and I'm really not interested in doing a lot of extractions anymore, or wisdom teeth or whatever. And maybe
Hmm.
I am ready to refer some things out. So then you
Yeah.
haven't burnt that bridge, with that doctor in the area.
Yeah. Yeah. I think that's a good way to put it, because I do have patients who come in and, would probably like all on X's, or, more of the advanced surgical procedures, which I can include in my treatment plan. And then if they show interest,
Yeah.
Well, what I think
I
he's
think
gone.
you froze there, doctor.
probably from some of this.
But one
Yeah.
of the main things that I found over the years, there's a reason the specialist comes to visit you.
Yeah.
It's not to help you with cases, but it's to help you give him referrals.
Yeah.
And then you can help him. But it's more a marketing deal. It's
Yeah.
they come to you to market their practice. And
Yeah.
and that's a great thing. There's nothing wrong with that. But he's not coming to question what you're doing. He's coming to ask you, hey, send me more patients.
Yeah, of course. And you can't blame
Well,
him for that.
that's good. That makes me feel a little better, because I felt like, man, is he coming to see, like, am I really doing all this stuff? Or
No,
probably like,
no. He's coming to tell you, hey, quit, because I'm not doing as much as I was doing. I'm on this PPO and I cut my teeth 30% with Sigma. Now I got to see more patients. I got to see 10 more patients every hour.
That's so true. That's so true. The other thing is, to his credit, I don't know this person, but if I saw a significant drop in referrals from someone, I'd want to know if there was something I had done to disturb the relationship. Maybe I'd insulted them in some way, you know. So,
yeah, yeah.
I
All
mean,
in all, I
And
think
you're
it'd be a
new.
good.
When you're new, the specialist is going to want to come see you.
and
Yeah.
they should be calling on you and wanting to have lunch with you, or bringing you lunch and meeting you and wanting to let you know that they're there if you need them and that kind of thing.
Hmm.
So, but just to call and say,
Okay.
hey, how come we're not getting any referrals from you guys anymore? You know, like I have no interest in coming over, and except for the fact that you're not referring anymore. So that's a little red flag right there. But that's
Yeah.
a very
Yeah,
good
but
question.
Becky, who our office assistant, felt very proud to say that we were able to, offer these services. And she even though it was an oral surgeon who called, she even included endo, because she didn't want him to feel like he was the only one.
Oh, that was
So
smart.
he said that, like, he's been doing a lot of molar endos and things that we, typically, um, we're referring, so, to kind of like make him feel like it wasn't just him,
Yeah,
which I thought that was.
that was very smart. She's very wise. I wonder when the last time was this oral surgeon came over to your practice.
So it's actually a father-son practice, and the son had visited us back in, I think, November when I first joined the practice,
Okay.
and he seemed very nice. He sent us like popcorn for Christmas and stuff.
Yeah.
Father's actually coming, so
Good deal. Good deal.
yeah.
All right. Very good question. Thanks for the wisdom that you guys shared. That's what this is all about, the mastermind. Anybody else have a quick question before we go? Dr. Paz, anything you want to ask?
Not off the top of my head.
Okay. All right. Well, I will say we had a great Zoom camp with the admin team, and I took 8 pages of notes last Friday on our second part 2. We did 2 separate days this time instead of 2 together. And I think they like that. I think we're going to do that again because it gives them a few weeks to implement a few things and come back with questions or success stories. That seemed to work well and give less information at one time so that it can kind of gel. And they really enjoyed some of the conversation that we had, the ideas shared. They loved hearing about other offices and what they're doing, and that they're not the only ones struggling with certain things. So that was fun. So I think Eric and I talked, and we're going to be doing another one probably in January, February. We'll do a Friday in January and a Friday in February, probably for the whole team, and maybe do it as a kickoff for the year and help you with some goal setting or annual conversation, something like that. So we're excited to continue doing those. The Zoom camp has been, even though it's not in person, which is fun, and we really enjoy doing that. We're able to get people like from Alaska. We had Alaska in the room, and we had Florida in the room. So we had a nice cross country mix, and it's hard to do that if you're traveling. So anyway, all right, it's bedtime, isn't it?
Not really.
For some of us. All right, you can staying up late these days, huh?
It's party time. Yeah, it's
Party time. Okay. Well, I have a 7 a.m. in the morning, so I'm gonna head out. How about you guys?
Yeah. Time to
Oh,
bed.
did anything ever happen about the mastermind meeting in October or anytime?
Everything was full. Everything was full. So
Good.
no, we're not gonna. We're still working on something like that, and I've got a couple ideas up my sleeve, and we're gonna keep talking about it. So, okay.
All right.
All right, everybody. Thanks for joining us.
Thank you, Paula.
Thank you.
Good night.